Listen up, heart disease, data without insights, and fragmented care. All of you are on our list. For those who won't rest until the world is healthier, neither will we. Optum, how well gets done.
John, the 55th annual HIMSS, I think you're setting a new record for attendance, aren't you?
Yeah, no, it's early days, first full day yet today, pre-conference workshops and everything, and the numbers are really good, pacing well ahead of last year, which was one of our biggest events. So we're expecting, if not a record, but a fairly good event this year.
And the people here are so passionate about it. You walk into the room, I mean, you feel the energy. They want to be here.
Yeah, it's always amazing watching people come for the first time.
Right.
You know, when they actually get to see what it's all about. And you get to see the whole world of healthcare and technology on that floor, and people from all over the world come. It's a global conference,
right?
And the kinds of people that come, you know, it's the world's best and brightest minds, doctors, physicians, technology innovators, people that are sort of really engaged in tackling the big problems of healthcare in really creative ways. So the energy's huge, and what you see on the floor is, you know, contingents from all over the world that come to share these ideas and this knowledge. So it's a really amazing event. It's unique. It's really unique.
Yeah, it really is. So how do you actually try to organize all the different vendors, all the different participants who want to come? It's not easy.
No, it's not. So to participate as an educator, it's a really rigorous process. It takes all year to build the program. The program is vetted by, you know, all sorts of subject matter experts, research in the field, feedback from the members, the volunteers, the communities.
And it's substantive. This is not big picture stuff. People here know what they're talking about.
Yeah, they do.
Yeah, the audience expects it.
They do, yeah. And so the quality of education is really high.
Right.
So there's a trade show floor, which is massive, and where there's a huge amount of conversation goes on. Last year, we think over 400,000 conversations took place in 4 days. So that's one piece of it. At the same time, there's over 2,000 hours of education. So thousands and thousands of people are going through those education sessions, taking with them ideas and practices, best practices, and knowledge that they can apply back home in their institutions. So,
yeah. What do you think the themes are this year?
Innovation, I think, is a big one, obviously.
Sure.
But that's more of a sort of a thing that runs through the events every year.
Right.
This industry thrives on innovation. It depends on it for two main reasons. One is to sort of pioneer new ways of tackling some of these huge problems that face healthcare and today. And the second thing is, you know, innovation is a major way of controlling cost. You know, if you can actually figure something out and do it in a creative way, it can end up saving you a lot of money in the long run. And particularly for hospitals and healthcare institutions, you know, doing that, innovating and eliminating expenses is a huge problem and a huge challenge.
Well, one of the things I've noticed is breaking down silos, right? If you can somehow break down the silos, then the information can flow. That's a cost save right there, isn't it?
Right, oh, absolutely. And I think so some of the other themes that you're going to see this year. Cloud is a very significant portion of what we're doing here. AI. So we had a show today with AI, standing room only. 8:30 in the morning, people literally packing the backs of the halls to tackle that one. So that's a big theme this year too. And I think the other thing too, there's a really big theme this year, which has always been here, but it's probably more prevalent than ever before, is the global conference. This is truly a global conference, global solutions, lots of people involved in doing that. So that's a big theme that I think has emerged this year and will be a dominant theme for us for the next few years as we build a global aspect of the conference. Yeah.
Sure, well, one of the things you're doing to make it more global is HIMSS TV. This is a first.
Yeah, absolutely.
How'd you decide to do it?
Well, I think the idea has been, you know, kicked around for quite some time. You know, the audience that comes here, it's a huge show. I mean, as I say, you know, over 45,000 people come. But most of the people that come are one or two people that come from every department or place or workplace across the world that's engaged in healthcare and technology. So there's a huge interest back home in what's going on at the show. And they used to rely on things like emails and the news that we post and everything else. But TV is a way to bring it home right away.
It's engaging, right?
Very engaging.
Yeah.
And I think it does a really good job of capturing the energy that you see at the show.
I think so.
Yeah.
I mean, we've got the sound of people, they're walking by as you and I are trying to speak. Sometimes we have to shout a little bit over them, but that's kind of what you want.
Yeah, exactly. Yeah, exactly. Yeah. So I think the energy is a really important thing. Also, the other thing too is that, you know, the way people are consuming their content now.
Right.
Video and TV are huge parts of the way that people consume their content, especially their news. So all those things together made perfect sense to try a TV thing. So here we are in our first year, and we're very happy with the results so far.
We certainly are. So this content, for example, our conversation, that gets pushed to people via email, it's on social, it's on websites, it's playing in the elevators of the hotels, on and on and on. And it's really going out to as many different places you can send it. And look at that, people are already trying to find you.
Yes, exactly. So.
That's good, you're man in demand.
Yeah, no, absolutely. So, and I think, HIMSS operates in over 52 countries.
Right.
And has a massive global audience. We sort of connect with people all over the world all year round. So with TV, I think it's a more intimate way of us connecting with that global audience day in, day out. So we're pretty excited about it.
Sure. Well, we're going to let you go connect with your iPhone and your iWatch, et cetera, et cetera.
Exactly.
All right, John. Congrats on the 55th
Thank you so
annual.
much. Absolutely. Thank you. Thanks a lot. Thank you.
So the vPro brand is really this umbrella that gives IT professionals this peace of mind when they buy that brand. And what it means is there's all sorts of different features and functionality within that vPro brand that deliver real value. So for example, you would have the ability to remotely activate, manage, secure, and keep track of these devices at the edge using active management technology from Intel. So this is really great for reducing operational costs and creating efficiencies for those IT professionals. And they're using these platforms that are already using today. So they're very familiar with how to use them and the tools that are used to remotely manage these devices. Furthermore, within that umbrella, you sort of get this long roadmap, 15 to 18 months of stability with our stable image platform. So what this does is it really gives the IT professionals this frame of mind and ability to know that when they buy that vPro brand, they have all of those things under that umbrella.
And then from a Lenovo hardware perspective, I think one of the beautiful things is we're able to offer that manageability with vPro processors and the whole gamut of our ThinkPad, ThinkCenter, and ThinkStation lineup. But we're bringing that kind of technology in a way that's really meaningful and helpful in that healthcare setting, right? The right types of technology in the right places really can streamline a workflow. They can help promote a good and meaningful patient interaction. And at the heart and soul of it, it can make sure that you have quick, easy access to the critical information you need. So when you look at something like our tiny desktop and tiny in one monitor, there's a time and a place, whether that's at a nurse's station or maybe that's at check-in or maybe it's actually at the patient bedside, where this kind of device really can be a game changer. And having that combined with vPro technology really is what makes it an excellent solution in the healthcare space.
Our next guest is someone you might not expect to meet at HIMSS, but I'm so glad he's here. Geir Renwick. He is Vice President of Business at Lyft. That's right, the guys who actually pick you up in a car. What are you doing here, Geir?
Yeah, well, thank you for having me here.
Thanks for being here.
Great to see the pink mustache spread across the floor as well.
Well, I originally thought it was a,
That's what I was hoping for as well,
exactly.
too. So I actually lead the healthcare team at Lyft, which is a team that I created 2.5 years ago when I actually joined the company. So I actually was at Google before this doing healthcare partnerships and joined Lyft originally actually to try to solve one of the fundamental problems in healthcare is transportation. How do we help individuals get to appointments in a more reliable manner? And really, transportation is the beginning of the continuum of care, and we're looking to try to solve some of the challenges that exist in that area. In other words, you are 72, you're living alone, you need to get to the doctor. How do you get there? Yeah, so our first population we targeted was actually Medicaid and Medicare, because we looked at those individuals were challenged where they didn't have a smartphone, they didn't have the means to pay for Lyft themselves, and we wanted to really solve that challenge. Today, 3.5 million patients miss appointments every year due to lack of transportation, and we think the solutions we're bringing to market, by the next 2 years, we think we can cut that number in half. So how does it work? I'm on Medicare or Medicaid, I need help getting to the doctor. Yeah, so over the past 2.5 years, we've partnered with really every piece of the ecosystem with healthcare. We've partnered with payers, we've partnered with health systems, we've partnered with technology solutions, and also transportation brokers. And so what we're doing is we're taking transportation and putting it in the hands of the caregivers. They're the ones paying for the rides, they're the ones calling it on behalf of the patients, so that individual has the benefit of transportation with never actually having to call it themselves or paying the bill for that ride. So a doctor's office is actually booking the car? Yeah, so we've given them tools built specifically for healthcare that allows them to call rides on demand or scheduled in advance, and then manage those rides real time and actually see where their patients are at all times. And then how does the doctor get reimbursed? So the doctor is either coming through Medicaid or Medicare, which
Right.
is paid for by the government for those rides. The other interesting thing is health systems are looking at it as an operational cost for them to drive efficiency for their systems.
Huh.
If you think about if a patient's ready to go
preventative,
home,
right?
it's
Yeah.
preventative. It helps them drive efficiency of people showing up to those appointments, and also it drives efficiency of helping individuals go home after those appointments are finished.
I mean, it's brilliant. It's so simple, so obvious, but I don't know. We didn't do it for so long. How'd this whole thing come together?
So it was my idea. So I joined Lyft really
like
with
this
the
is
business
your
plan.
baby.
This was my baby 2.5 years
Well
ago.
done.
So
Good man.
Thank you. I appreciate
Wow.
it. So it was an idea that I felt like was a problem to solve. Google was getting into autonomous vehicles, looking at transporting people that were blind, disabled, or elderly, really small scale. And I really became passionate about that space and saw the use case that was there. Came to Lyft, basically put together a business plan and said, you should hire me and you should let me build out a team. 2.5 years later now, we have partnerships with 9 of the top 10 health systems, 10 out of 10 transportation brokers, some of the largest health plans in the country, and then even this week we announced a partnership with Allscripts, which was the first time we're actually integrating directly into an EHR to drive that much more efficiency. So a provider now can actually call Lyft without ever leaving the workflow they're using today.
So you mentioned transportation broker. That's not something, I can understand why it would exist, but it's not something I've ever heard of. What is that?
So transportation brokers actually manage the transportation benefit for those on Medicaid and Medicare Advantage. So when an individual is on Medicaid, instead of going directly to the health plan, the transportation brokers manage that benefit on behalf of the patients. So a patient was calling the transportation broker, and now all 10 of the top brokers partner with Lyft to provide that transportation benefit to those members. So it drives efficiency, it's cost savings, and it's a better experience for the actual member.
Are there any limits? Like, for example, if someone lives in a rural area 20 miles from a doctor or 40 miles from a doctor, that can get expensive.
It can. So Lyft's coverage today is 95% of America's population. So we really have addressed some of those rural areas that exist there. If you look at the providers they were using before, our cost savings are 30 to sometimes 50% more affordable than they're using before. So even for those long haul trips, we're actually providing cost savings to those benefits. The other piece that's interesting is in Medicaid, a significant challenge with fraud, waste, and abuse. The kind of accountability of those trips that happen. We provide a digital footprint of those trips and actual accurate recording of where those trips occurred.
You know, this is going to sound trite, but it's a great illustration of your last point. A friend of mine in the city who owns a number of McDonald's where everything is automated also owns a number of Irish bars back in New York City. What he found was that when he put everything on a digital platform, no longer cash, fraud went out the door.
Absolutely, and that's the challenge we'd love to be able to solve. We think that we can cut costs by being a more affordable option, but we can also, we think, cut 30% of that savings for Medicaid and Medicare as well. So it's exciting.
And maybe save some lives in the process.
Yeah, and an interesting piece is we think longer term, adding transportation as a benefit can not only lower costs for the payers, but we actually improve health outcomes. And that's what we're really excited about, is ultimately trying to solve that problem and providing a better experience for our patients.
Wow, just fascinating. Is anybody else doing this?
So we were the first one to the space. Like I said, we've been doing this for 2.5 years. There's other players that have got into it. Again, our approach has really been to focus on the entire ecosystem. So really, again, focus on all quadrants of that. The relationships we have now really position us well to actually leverage those relationships to really solve this challenge together. So again, the Allscripts announcement is exciting because we're partnering with Allscripts, who works with Ascension, another one of our partners, to actually bring all these solutions together, as well as some of the top payers like Blue Cross Blue Shield. So we think we're well positioned really to bring this market together. And again, over the next 2 years, we think we can solve a significant challenge that exists.
All right, Geyer, thank you so much.
Thank you, I appreciate it.
All right, welcome back. Like so many people here at HIMSS, we now have an opportunity to speak with a doctor who has shifted to business. She is Geeta Nair, Chief Healthcare and Innovation Officer at Femwell Health Group. Doctor, thank you for being here.
Thank you. Thank you for inviting me.
You were again, a rheumatologist and decided that you wanted to make a switch to business. Why?
Well, you know, I didn't go to medical school thinking I would ever do this stuff, right?
Of course.
I went to medical school because I wanted to take care of patients and I wanted to do it well. And one of the most frustrating things about being a physician today is it's very hard to do that because so many of the tools that we have to use as physicians actually slow us down. So with my clinical background, my business background, and my IT background, I'm really able to make an impact on thousands of patients in a way that I simply couldn't do in one-on-one patient care. So it's incredibly exciting and gratifying for me.
So when Femwell approached you, how'd they describe the opportunity?
Well, you know, there's a group of 500 docs. We're an MSO in South Florida. We have about 500 physicians, and they have a lot of challenges like every physician around the country. And they said, you seem to get this IT stuff, you seem to get the clinical stuff, and we need someone who's going to help our doctors be able to scale and take care of our patient population better.
One of the themes I think that, and this is not exactly new news, that EHR isn't working and we're reinventing it and finding new solutions. But was that part of your job description, part of your mission, just reinvent this, streamline it, make it easier for our doctors?
You know, a little bit of everything, right? So now in a value-based care environment, it's all about the patient, it's all about how to engage the patient to actually be healthy, and that's what I'm really seeing at today's show, is it's really about how do we actually make things interoperable, how do we get the patient, not just to manage a population, but to engage, because once you engage the patient, they're healthy and the population is healthy.
Here's the tricky part that, and I'm not sure anyone has really figured this out. If you're no longer getting fees for service because you're, in theory, providing fewer services to keep the patient healthier, how do you make it worth doctors' while, you know, to make that transition?
Sure. So it's all about the outcomes, right? And again, the reason I mentioned patient engagement is, as I said, we know that patient engagement is tied to outcomes. So as a physician, I want my patients to get better, and if I can get paid for them to get better, I don't need to worry about doing 10 other procedures to get there. And you know, one of the biggest chatter that I've seen also at the show is around class. Class for the first time covered patient engagement as a category. It's no longer about EHR, it's now an entire category because we're seeing that that is the only way we're going to be able to connect the dots. It's not about the vendors, it's not about the doctors, it's actually about the patients helping us get to the outcomes that we want.
All right, so let's say we've got a patient under the old system, a patient under the new system. In the old system, there's fee for service, and the person has to go back into the hospital. In the new system, there was some sort of preventative treatment. Person doesn't go back in the hospital. Because the person doesn't go back and is compared to the other person, there's a bonus paid to a doctor?
Well, again, it's about outcomes, right? And it's about really meeting the patient at the point of care. So if there are things that I can do to prevent you from going to the hospital, absolutely, we want to make sure we're doing that. And if we can text you, remind you need to come in to get your eyes checked, you have glasses, you got to come once a year to get your eyes checked, right? You don't want to wait till you have a cataract, you don't want to wait till you have glaucoma. So there are all kinds of things that we can now manage and metrics that we know are very measurable, right? So even at the end of the day, if you end up in the hospital, but you followed sort of the normal preventative task force measures, absolutely, as a physician, you should be incentivized for that because you can only do so much. But again, it's about bringing the actual patient into the picture and saying, you know, if you get these things checked, you won't go to the ER, which is kind of what you want too, right?
Yeah, I'm just trying to figure out, you know, as we extrapolate and go out, you know, 2 or 3 decades, you know, what does it look like? I mean, teachers get bonuses if test scores are higher. Some will debate whether or not they should, but that's standard practice. Is there an equivalent way to think about it within healthcare?
Absolutely. I think that, again, value-based care is still evolving, right? But there's any number of metrics that we know are very good metrics for any population, whether they're diabetics, hypertensives. So it's about following the standard of care and making sure that the metrics are really solidly determined and measured and transparent, both to patients and to docs.
Any moonshots here that you have seen at HIMSS18?
Sure. So, you know, again, I think it's really about patient engagement. The partner of choice for us is HealthGrid. We are doing some really amazing stuff in the female wellness space in South Florida. And we're really finding that when we meet patients, when we meet women where they're at, whether they need to get a mammogram, a pap smear, an annual well visit, a simple text actually goes a long way. And it's nobody wants to sign into a portal. Nobody wants to have to remember a username or a login. And so we're actually finding the mobile connection does a lot for us. We also are very much behind telemedicine and the idea that, again, we're going to meet you where you're at, and hopefully that's not an emergency room. So by making it easy, by making it mobile, and really meeting patients where they're at, which is on their phone, we get a lot more bang for the buck.
It's funny, there's an intimacy to the phone. When you get a text, it somehow feels better.
You know, and actually a lot of our patients are actually texting back saying, gee, Dr. Nair, thanks for texting me.
Right.
And they're actually having a conversation.
Yeah,
like, you know, and it's phenomenal what a few texts will do. And all of a sudden it's like, you know what, I will come in. You send me that text, I am gonna come in. I meant to make that appointment, and since I now just gotta click and press a C for confirmation, I'm gonna make sure I come, and thanks for reminding me to bring my medications.
Yeah. And by the way, thank you for being here.
Thank you, Adam. Appreciate it. Thank you.
Dr. Nair.